For this video on the Brain Injury Recovery Guide, we are talking about sleeping right. So no matter how you suffered your brain injury, whether it's a concussion, a traumatic brain injury, a stroke, post-infectious brain injury, sleep is one of the most important things. This is very much a make or break. A lot of people following brain injuries can ultimately end up with a sleep disorder. There are those who are lucky and they end up sleeping more, okay? I'm not worried about their recovery. I'm worried about those that are sleeping less. It now takes them 45 minutes to 2 hours to fall asleep at night when it used to be 10 minutes. People who are waking up, tossing and turning throughout the entire night. And now all of a sudden, their sleep time went from 7 to 9 hours and they're now down to 3 to 5, 3 to 6. Recovery becomes a lot harder. When we look at the brain, there's this internal waste removal system known as your lymphatic system. It is most active and efficient during proper stages of sleep. But if you're tossing and turning, you're not going to get into those stages of sleep. This ultimately, think about it like trash is stinky. It's inflammation. This inflammation keeps your brain inflamed and ultimately impacts your ability to recover. So a few tips to help with sleep. Your sleep actually starts first thing in the morning. So when you wake up, get out in the sun, even if it's only for 5 to 10 minutes. You have this internal clock called the circadian rhythm. By doing this, you're helping to say, look, this is the time I should be awake. This is what we want the circadian rhythm to be programmed for. Now, as you're getting closer to bed, make sure you're eating 4, maybe even 5 hours before bed. Eating too close to bed, 2 to 3 hours, having alcohol at night, all those things will impact your sleep for a lot of people with brain injuries. And really in the general population, those are good ways to mess with your sleep as well. Now, turn off all electronics, turn off artificial lighting, maybe some candles, there's other lights you can get that will also help better with sleep. You can use red or amber lens glasses as well to also help calm things down. Maybe consider an Epsom soak. You can get a nice lavender or whatever you want to use and go from a nice warm soak to a cold bath. So those are some things you really want to consider to help you sleep. There are nutritional supplements that can be done. I don't go to the medications unless I absolutely have to because there's a lot of trade-offs with those. But needless to say, getting your sleep as good as it can be is critically important for your recovery. And there's a lot of strategies that can be done to help with it. So yes, I understand it can be frustrating, but there's also ways to help improve it. Hope you found this useful, and please check out the other videos on the Brain Injury Recovery Guide. And until next time, this is Dr. Z.